what really tipped it off was the two 14-year-olds, and now I think it was last week was the 2-year-old that have come in as victims of homicide.
And that's when you said enough is enough. What do you think is the issue? Because it's clear there is a systemic issue with gun violence, not only here in Central Ohio, but beyond. Mm-hmm. What do you think?
Right. So we're not the only city seeing this, obviously. I think some of the larger urban cities, we've seen Chicago, and same thing with New York City. They're seeing an increase in homicide. Again, a lot of this has to do right now with COVID-19, with some of the opening, or let's just say more awareness with racial inequity, just the anger that's out there. I think COVID-19 has increased the amount of anxiety and almost panic in people, and those are just linchpins, if you will, for mental health issues and problems, and from there you end up with an increase in substance use disorders, an increase in suicidal ideations, and an increase in violence. The others are things like the social determinants of health that we talk about. So it's things like poverty, things like just feeling you're never going to get out of where you are. So it's just a sense of despair. Then there's just the whole drug culture that's out there that has increased tremendously in the United States from, I think, 2012 on, which has brought about, what they call business opportunities, right? The need for people to sell the drugs, as well as the need for people to manufacture some of these drugs. So
you talk about your vision would be to see an Office of Violence Prevention, right? 4 principles: coordination, transparency, accountability, programs to promote social justice. Are you asking the mayor to include that as part of his initiatives to deal with the summer violence?
Those were my thoughts that I felt would make for a successful addressing of the violence issue here.
At the same time, I've seen some articles that had you talking about the fact that, we also have maybe too many groups working separately. So what needs to be done? Is this a city issue? Is this a metro area issue? Like you said, it's a countywide issue, but at some point there's got to be collaboration. Otherwise, we're really getting nowhere.
Right. So that's why I called for, one of my points was collaboration. So collaboration meaning, let's see how many people are working on violence. Let's develop a list. Let's bring these folks together and see where we can coordinate all their efforts to best address the issue, and to perhaps not duplicate. Sometimes you duplicate things. So figuring out who's doing what, and bringing folks together, because you see small groups leading different things. Pastors, religious organizations, they're great. I think it's a great thing to do community-wide, but let's see what each one is doing.
When we talk about making sure we can hold people accountable, or city leaders, if they say they're going to, have something to address summer violence, people expect results. Do you find there should be some accountability on caregivers, parents, grandparents, whomever is raising these young people?
There is accountability within the community, right? So if someone and that's been an issue apparently that law enforcement has talked about, that within the communities, people do not speak up. So people need to speak up when they see something that's going on. I know that there are fears of retaliation, but somewhere along the line, someone's going to have to say something in order for folks to know what's going on within the communities. And I run an overdose fatality review, and what we found is a lot of time the folks who die of overdoses or who have chronic substance use disorders have come from families that have substance use disorder in the family, or they have come from families where violence was perpetrated, either to the parents or to themselves. So again, these families where perhaps violence is the youth are looking towards violence, very complicated family dynamic. So it does take, for example, I saw Commissioner Boyce wanted a family stabilization unit or program. So it would take something like that, someone going to the family where you know that there's a youth involved in violence and speaking to them to see what their needs are. Kind of like a case management unit looking at the families.
It sounds like what you're saying, Dr. Ortiz, is a more holistic approach.
Yes. Mm-hmm. Yes.
You know, by the short definition of what you do, it seems like, you know, you're on the reaction end of the violence and what happens on that end. So you have clearly taken a very proactive approach, right, to basically say someone needs to do something so I don't have all these bodies at my morgue, right? So what do you plan to do from here on out? You told everyone, city leaders, county leaders, what you would like to see. What are you going to do if that doesn't happen or that doesn't change?
What I would have liked would have been more, like one of my points was transparency. So how many points of violence have we had in the month of July, in the month of August, and then keeping kind of a track so that people can see it's decreasing. The increase in the shot spotter use, you know, that's brought some decrease in episodes of violence or, you know, homicides. So I would like to see more of a transparency, and if that, you know, that doesn't happen, I mean, I will continue to keep a track of our own, what's going on with our own agency and let people know as it occurs where we are at each point in time.
What's the final message you want people to know of what you are doing to make a difference?
I think one of my biggest goals for this office is to connect our office to the community. And unfortunately, we deal with death here in our agency. I mean, just plain fact, that is what we deal with. But you know what? We can use that to help prevent deaths. And so that is what I do, and that is what I will continue to do, hopefully for the next 4 years, is to use the unfortunate deaths, to use these statistics, to use these people that have died and have come through this agency to promote change and to promote preventive actions.
That's something that is a lesson for so many of us that need to hear, because you don't get a second chance if you end up at the county morgue.
No, you do not.
Dr. Ortiz, thank you for your time. Your heartfelt plea to the public and to city and county leaders for trying to save lives out there. I appreciate what you're doing and having a voice out there. Thank you.
And thank you. Thank you for inviting me and letting me say my words.